Hi, my name is Rachel LeBlanc, and today I will be talking to you about Do Not Resuscitate Orders, also known as DNRs. A DNR is a more specific type of a living will. This is also known as a medical or a physician's directive. A DNR encompasses the desire of the patient in certain scenarios. An example of this would be if they would want CPR should cardiac arrest occur. If they have a DNR, they would not get CPR. When properly executed, it gives physicians immunity from the claims of negligence and wrongdoing in a patient's death. Nurses also have a duty to respect the patient's wishes in these cases. The picture is an example of what a DNR looks like. The history of DNRs. DNRs were first described in the early 1970s. By 1974, the AMA proposed that DNRs should be documented in the patient's medical records and should also be communicated to other staff members who care for this patient. This protocol has been shown that when the documentation isn't properly reported, patients can risk receiving unwanted CPR. Problems with DNRs. There have been several problems that have been noted in the use of DNRs. So these orders can be unclear and the documentation on a DNR can be inconsistent. A DNR doesn't mean that the patient and/or family have been fully informed on its meanings. According to Cherry and Jacob, 3 problems may arise regarding a DNR order. A physician refuses to comply with the patient's wishes and initiates CPR. The patient revokes consent to DNR order. A family member demands the DNR order to be rescinded despite the patient's continued objection to CPR. Should any of these 3 situations occur, the nurses must act quickly to involve the nurse, supervisor, and administration. Nurses' roles in a DNR order. Nurses spend the most time with the patient, providing bedside nursing and medical care throughout the day, and are often the ones who initiate the DNR discussion. There has also been expressed needs for clear and well-documented DNR orders and informed patients and relatives by the nurses. This will help them provide good nursing care. For example, extra support to the families, helping the patient to a peaceful death, and avoiding unwanted CPR. Nurses are lawfully expected to execute a DNR order. If these are not followed exactly, nurses can be sued for failure to observe DNR orders. Claims include battery, negligent infliction of pain and suffering, and wrongful life. There have been several barriers noted to making a clear DNR decision. So some of these are to not cause worry in the patient, not to take away patients' hopes, lack of physician experience and feeling of discomfort, timing of the discussion, and risk of making the wrong decision. Signing a DNR order is a big ethical decision. It can be difficult and possibly cause conflict of interest between the patient, family, and the interprofessional team. An example would be disagreement between the interprofessional team if the patient really should have a DNR or not, and if the patient and/or relatives should be informed or not. It has also been reported by doctors that they experience ethical conflicts when regulations require information to patients about a DNR decision, but they consider it being against the patient's best interest. This is a complicated process involving the nurses and physicians with different experiences and perspectives. Results of my evidence-based article. This article looked at a survey of nurses and physicians in hematology and oncology on the DNR decision process. The research concluded that nurses and physicians needed to talk openly about their different perspectives on DNR decisions. It should be known to them that what they think is important is not always likely to happen. This is particularly important for nurses because physicians are the decision makers, and this will help them avoid moral distrust by knowing the reasons for DNR/CPR decisions. The essentials of baccalaureate education for professional nursing practice related to DNRs. The most important part that applies to the DNR order is effective communication and collaboration among health professionals. To deliver high quality and safe patient care, you need to have teamwork between the healthcare professionals. Collaboration is based on complementaries of roles and the understanding of these roles by the members of the healthcare team. Cues and competencies related to DNRs. The competencies that are related to DNR is patient-centered care, teamwork and collaboration, evidence-based practice, and safety. The one that applies the most is patient-centered care. This is shown by giving the patient and family what they want. The next biggest one is teamwork and collaboration. Nurses and physicians have to work together to help make the decision if they need to approach the family about this, and then need to work together to provide the information to the family and patient. Next would be evidence-based practice. This is useful in knowing if the situation even warrants a DNR discussion. Lastly would be safety. This applies by protecting the nurses and physicians from repercussions of not performing CPR on a patient who died. And this is my references. Thank you for watching.